Hello, viewers. Today on my YouTube channel, I'm very happy to welcome Dr. Sunupam Majumdar. He is a very famous ENT specialist from India and he is currently preparing for MRCS ENT OSCE. We have had long discussions about how to prepare for both MRCS Part A and now we are talking about MRCS ENT OSCE, but I felt that uploading a small part of our discussion online might help answer questions that many other applicants, many other examinees might be having regarding MRCS ENT OSCE. So I hope you will benefit from this discussion with Dr. Sunupam Majumdar. Welcome, Dr. Sunupam, to my channel. Finally, we are getting to meet here. Thank you so much for joining me.
Thank you. Thank you. Can you hear me?
Yes, you are audible, loud and clear, and also
Thank you.
it's very nice to have you here. So I was wondering, you
Thank
have
you.
some questions for me. Please ask.
Yeah, I'm going for the main session. So I have some questions regarding the exam, right, on the main station actually. So can you please guide us, about the attire and how to present us? What should we take with us into the exam hall?
Okay, so that is a very interesting question and very important also. In the May exam, as far as the research that I have done, this is going to be held in Edinburgh in Scotland, and
Yeah.
it will be held from 19th May till 30th May. Now,
Yes.
when I had appeared in the exam in 2023, also in the month of May, it was held in Glasgow, and the gap between the non-manned exam and the manned exam was only 48 hours. So I was in Glasgow for both parts. Now I believe the first part of the exam, the non-manned exam that can be taken on a laptop, it is usually held on day one, which is usually the first day itself, that is 19th May.
Yeah.
And then you can go after about a week to Edinburgh.
Yeah.
Now,
Okay.
before the exact date will be intimated to you by the Royal College of Surgeons you apply through. So you know the exact date. That is the first thing you need to know, the exact date of your exam, because all the band exams are not held on the same date. They are not even held at the same time. So you will know your own time slot and your date and also the exam venue. This is very important because the exam venue is not always the Royal College of Surgeons building in the concerned city, because my exam itself was not held in the Royal College of Surgeons. Usually it is held in the Royal College of Surgeons. So you will get an admit card kind of a document sent by email. So that document you need to carry with yourself and you need to reach the venue preferably 1 hour in advance. They will not tell you that, but it is always advisable to reach before time than to reach 5 minutes late, because it's these exams, they are held in a queue system. You are quite familiar with the OSCE pattern because you've appeared
Yes.
in ENB. So
Yes.
setting up the queue and ensuring that everybody goes to the stations, it requires time to organize, so you have to reach ahead of time. In terms of what you need to carry, that is the only thing I remember. You only need to carry your that letter with you and some kind of an identity document. Although from my memory, they did not check anything. They just asked me my name. My name was on their
Okay.
list, and they didn't even take the admit card. They gave it back to me. I still have it with me, but it's better to carry it always.
Do you have to take
Uh,
our passports?
Yes, passport is the identity document. You should carry it with you just to be on the safe side. As far as the attire is concerned, the attire is nothing fancy, because it's not an exam where you have to, it's not an interview. For the interview,
Okay.
the attire matters a lot. That comes
Okay.
much later. But for the exam, you are examining a patient. So your attire has to mimic the attire that you will be wearing during your interactions with patients in your outpatient
Okay.
clinic. So the
Okay.
main thing is you need to wear a shirt, and of course it is, this is the UK, so you will be going there in fairly cold weather, so you'll be covered up with lots of layers. But once you're inside the building, they are properly heated, so you will not be feeling cold inside the building. So during the exam, you'll just be wearing a shirt, and the sleeves of the shirt should be folded up above the elbow on both hands. You have to
Okay.
have your hand exposed, the forearm and the hand exposed, and you should not be wearing any jewelry or anything metallic, anything on your fingers or your wrist. None of that is allowed. You should not be carrying even your smartphones, none of that. I
Okay.
don't think you need to carry a pen, but because they supply all these things, they supply stationery,
Okay.
pen and pencil, all of that is supplied there. So in terms of attire, that's it. Just a normal shirt and trousers, no tie, nothing. None of that is required. If you are wearing a tie, they
Okay.
might ask you to remove it. So
Okay.
none of that is required. It's fairly easy in terms of attire.
Okay. So we have to, or we have to remove our rings and everything.
Yes.
That is clear. Okay.
Yes, so that is actually very
Um,
important. Although being surgeons, we have the habit of removing rings. But I knew a person who was wearing a wedding ring. He was sitting next to me and he was asked to
that
remove
was
his
the
wedding
question.
ring. He was not able to remove it, probably had never removed it after his wedding.
Okay.
And he was given some kind of an instrument to help break the ring. His finger was swollen, red and swollen
Okay.
in the in the cold of May, Glasgow. It's not winter, but it felt like winter for us Indians. But that is quite uncomfortable. So yes, of course, rings have to be removed. They're very particular about these things.
Do we have to wear any aprons?
No, no. So they don't have this app. No, they don't have this requirement. It is just,
Okay.
again, back then it was called COVID appropriate attire. I don't know if that is still there, but they will have something called a briefing session before your exam, just before your exam, and they will tell you in detail that this is the thing that you need to wear, and they will not ask you for things that are difficult to procure at the last moment. So usually you have to just expose your upper limb from the
Arms.
elbow downwards. Yes.
So no suits or anything like that.
No, that is important for the NHS interview, not during the
Okay.
MRCS. No.
Okay. That's good to know. So, Dr. Pushpan, can you just guide us what happened when you reached there and how the exam is been carried out? I mean, all the registration process and everything. So you go to one room to another, or how the OSCEs are displayed, or like that. I mean, the man station.
Yeah, thank you for asking that question. Without divulging the details, because of course we are supposed to keep it confidential, I'll tell you
Oh, yes.
broadly the overview of the exam. So I had, as I said, I had reached Glasgow on a Sunday, and the manned exam was on a Wednesday. And
Okay.
after the non-manned exam, I did go to this place where the exam was held. So I was familiar with the location of the venue. That is very important. You don't want to get lost on the day of the exam. So I knew
Right.
exactly where the venue was. It was walking distance from my hotel. And
Okay.
my exam, I think, was in the morning. I think somewhere around 11 or 12, I'm not entirely wrong. So I reached there almost 1.5 hours before the scheduled beginning of the exam. So
Okay.
I was waiting outside the building. While waiting outside, there is no way to understand that the exam is going on inside. So it was quite cold also. So I decided to maybe knock on the door, and somebody opened the door, and they were quite alarmed to see me because they felt that I was half an hour late for the previous session, while I was one and a
Oh,
half hours too early for the next session. So they asked me whether I want to wait outside in the cold or do I want to wait inside where the weather is much more pleasant. So I said, of course, I want to
okay.
wait inside. So they ushered me into this room where it was a very big room with lots of chairs and lots of waiting room. So I was the first person to enter the room, and there was a place where we could keep our bags. There were food packets, so we could eat also, and we were. I was told that I could just read our books, the books that we were carrying with us, and they would call us. So once I
Okay.
entered, I think I waited for almost 2 hours. I was just there in that room, and slowly the room started filling up, and that is a very remarkable feeling because then you actually feel like you're part of the world because you see people
Okay.
of different ethnicities filing into the room, and then you feel that okay, this is not just an exam which you are appearing in your local area. This is an international exam. You get that feel during the exam.
Okay.
So while I was waiting, I saw the room fill up, and then the briefing session happened where we were explained the different stations. There are these test stations, there are rest stations, and you also have
Okay.
something called prep stations. So three types of names:
Okay.
prep stations, test stations,
Okay.
and rest station. Rest station, as the name
Okay.
suggests, you are supposed to do nothing but rest. And in
Mm.
the prep station, you can mentally prepare for the test that lies ahead.
Mm.
And of course, in the test station, you
Mm.
have to do the task. Usually, the task need to
Okay.
be done in a time that will be intimated to you. You
Mm.
don't get to check the time while you're performing the task, which is what makes it very
Mm.
important to practice
Indeed.
repeatedly.
Mm.
And there are
Mm.
certain things you have to keep in mind, like washing hands, sanitizing hands, wearing gloves.
Mm.
All these things are very easy to forget in the when you have the
Mm.
stress of the exam. So that's important.
Mm.
Also, they told us exactly the sequence to follow. And
Mm.
I remember there was an A sequence and a B sequence, and they told us about a particular exam where somebody messed up. They went in the wrong
Okay.
direction, and their exam was completely complicated because of that. So
Okay.
you have to remember the sequence in which you need to go, and there'll be many people there helping you to go from one station to another. So once you are in a
Mm.
station, you'll be guided in. Once you leave it, you'll be guided to the next station. You just have to follow the guidance that you will be receiving there. It's very straightforward. And before you know it, almost in about, you
Mm.
have to wait for 2 hours for the exam to start. But the exam is over
Okay.
in only about 30-35 minutes. So before you know it, the exam is
Okay.
done, and then they give you a debriefing session where they ask for feedback from you. And many people gave
Mm.
lots of feedback. Some people even complained about the exam. And
Mm.
I only had one question regarding one particular question which I felt I had not done well in, and I just wanted to know how
Mm.
much marks was attributed to that particular question. I was very happy that it was only 1 mark. So
Okay.
that's the only question I had asked. And so overall, there is even a person in the exam whose job is
Mm.
to monitor whether any kind of discrimination is happening against a particular candidate or not. So if you have any
Okay.
complaints where you feel that something bad is happening to you, you can actually approach that person
Mm.
in confidence, and
Okay.
you can say whatever you feel is wrong. So that's a very
Right.
good system. And I want to add that
Mm.
this 48 hours gap was
Mm.
quite difficult for
Mm.
many people.
Yeah.
And we gave the feedback that we want this gap to be longer, and I believe many
Mm.
other people also did, but now the
Mm.
gap is extended to 10 days, which is a very good thing.
Mm. Yeah. And also, is there any gap between two stations, or just you hop off from one to another?
So this is different for different candidates. Usually,
Okay.
what happens is there is a prep station between
Mm.
two stations. So if you have
Mm.
station one, you may have a prep
Mm.
station before it. So during that time, you
Mm.
are preparing yourself regarding how you will approach the station. You will have the question with you. You will not have the patient with you. So you're
Okay.
preparing how you will deal with the station so you get 7 minutes or whatever the time is
Mm.
to
Mm.
mentally prepare yourself. Usually you get
Mm.
that 7 minutes before every test station, but sometimes they are one after the other. Now,
Okay.
sometimes there are 5 stations, sometimes there are 6 stations, sometimes there are 4 stations. It varies from exam to exam and from candidate to candidate.
Okay.
Some candidates
Okay.
get this time in the beginning of the exam, like the first
Mm.
station, they have a prep station before it. Some candidates get the
Mm.
time at the end of the exam. What remains constant is
Mm.
every candidate has the same number of test stations, prep stations, and rest stations. So
Mm.
there is no discrimination of any kind. But the time that you get for preparation, sometimes it's at the before the first few, sometimes it's before
All
the last few.
the, okay. Okay. Thanks. And also, I have one question that is it better to uh, visit the place just 2 or 3 days before the exam, right? Then we'll get to know the place and when to, to recognize the place and get familiar with the environment and everything. What
Yes,
do you advise?
yes, it's very important to, if not for anything else, then for last minute
Mm.
travel mishaps that can happen. So I know a
Mm.
person
Mm.
who had booked a flight ticket a day before the exam, and the flight got
Oh.
cancelled because of weather events. So
Mm.
that's something which we have no control over. There was a
Mm.
cyclonic activity happening in the Bay of Bengal, and the flights got
Mm.
cancelled. So you can never
Okay.
predict that. So it's always advisable to reach a few days beforehand, and
Mm.
just to avoid this, if not for anything else. And
Mm.
also you can
Mm.
acclimatize yourself with the climate there, which is
Mm.
also important. And
Mm.
you will be getting the details of the exam venue. So when you are booking the accommodation there, if you are staying in a hotel, it is always advisable to book the hotel near the venue of the exam, because then
Okay.
you can rely on walking to the venue, because
Okay.
who knows if you'll get public transport or other
Yeah.
transport. So it's
That's.
always, that is something I did. I booked a hotel which was walking distance from the venue, and it took me, I think, 15 minutes to walk there. So that is the
Okay.
strategy I had employed.
Okay, thank you. Thanks a lot. I have some questions, but I just want to ask you on a next date, and
Okay,
let us keep it simple and short. Then we can
that's
have
fine. I
multiple
think
sessions.
I think all of your questions will benefit not just you, but all the people who are preparing for MRCS and are making the mistake of watching my channel, I suppose. So
You're always joking about that.
thank you for
It's a
taking
good
out.
channel. I recommend everybody to see Dr. Pushpan's channel, and it's a very good and informative. And he's a very meticulous person. I know him personally. So all the best, and all the best to your channel.
Thank you so much, Dr. Sunupam, for the kind words, and I hope we will see you again on this channel very soon. Take care.
Yeah, thank you. Thank you. Bye bye.